Oja, Assistant Professor, Department of Computer Science and Engineering, would like to welcome you all in 1 week FDP on recent trend in computation, data processing, and security, organized by Computer Science and Engineering Department. Today, this is second day of FDP and we are going to have a topic healthcare data, veracity, interoperability, privacy and security concerns and strategies. This topic is going to delivered by Dr. Vinay Tosh Mishra. It's my pleasure to introduce Dr. Vinay Tosh Mishra, sir. Dr. Vinay Tosh Mishra is an associate professor for healthcare management at the College of Healthcare Management and Economics, Gulf Medical University, UAE. Sir has more than 14 years of experience in industries like healthcare, finance, and information technology. He was instrumental in making a diabetes specialty clinic into a 50-bed multi-specialty clinic. Sir was also program director for two successful long duration programs, namely Building Intelligent Healthcare Analytics and PGPM in Healthcare Management and Analytics. Sir is also a certified diabetes educator and green belt in Lean Six Sigma. Sir has published in Journal of International Repute and served as an editorial board member of reputed journals such as Hospital Topics, Digital Health, Abhigyan. His research interests include healthcare supply chain, complex adoptive system, healthcare system, and digital health. Sir, I welcome you to this session.
Thank
As
you
we
for,
all,
yeah,
thank you,
go
sir.
ahead.
As we
Thank,
all know that the truthfulness, privacy, and security regarding healthcare data play important role in our research also. So now, sir is going to enlighten us with today's topic. I want to inform one thing also. If you want to query related to healthcare data, then please put your question in chat box. At the end of this session, question will taken by sir. Thank you so much. Over to you, sir.
thank you for such a nice introduction, and thank you, Sarika ma'am, for invitation.
It's our pleasure, sir. So you accepted, despite of your so much of busyness, you spared time for we people. Thank you so much.
No, ma'am, always for Varanasi and Ashoka Institute, and always for you, and we have long association for that. And one
Yes.
thing I keep saying, after 10 year or 20 year or maybe sooner than that, we will be there in Varanasi only because that is our place. So with these words, I will start and let me know if you can see my slides. It's fine.
Yeah, it's visible.
It's visible. So now, because this is a computer science um, FDP. Now it's not about when I started some with the simple some context I will give you, and actually I will this healthcare data management is one of the domain. Um, it's fine. You can learn from means I did many things in my life. So I started from being an electronics engineer and I was very motivated. That's why I left computer science in IIT BHU and joined electronics engineering. So that is one thing. So, but computers, electronics also, we were mostly taught computer science because that job was in demand and something like that. And then I did MBA, then I did PhD in healthcare management. And then, of course, I'm engaged as for doctor in science program with mathematics department BHU and postdoc from Arizona University in healthcare management. So this all is AI driven, no? So the thing is, the thing is shifting, and because here the faculties and maybe professionals and students are joining this session, have you ever thought why Google, Facebook, and these companies like Microsoft and the other fired in a huge number? Because their skill set of the people have they were not matching with. Yes. Yeah. we're not matching with. Let me know if you're not able to listen me properly, and if you have any query. These are so there was a gap, and that's why so many job loss. It doesn't mean there are not job, right? Orientation is not there. So there was a big bubble in tech companies related to IT especially, and we were not solving actual problem. We were creating product and we were pushing it into market, which we call in supply chain. Not pulling means on the basis of solution. Now, the more your IT will be focused in future, will be solving problem. If you think about this data driven healthcare, think about just every one of you is aware about ChatGPT. Everyone has known and everyone had heard about ChatGPT now. Yes or no? Okay, I'm not able to hear anyone. So everyone knows about ChatGPT. So it's not a new phenomenon. Large language models were there from 2007 onwards and all. I was using it in different capacity, but this ChatGPT came because OpenAI was behind that, and Microsoft acquired some portion of that in 2018, and then it became into now buzzword, and everyone is using it and everyone is thinking about that. You use ChatGPT and your eye will be open. The coding is that easy that everything in now computer science is not about coding. Coding is being done by a 8-year-old white hat junior you have thought about. Now just use ChatGPT, and right there you can use it ChatGPT to write small codes and for using R or Python or anything. So if you are a coder and you are memorizing the syntax, that will not make you a great computer scientist in near future. So forget about that. So it's about being a domain expert, solving real problem, understanding what problems are there, coming with solutions so that you can solve that. And this is one of the area which is healthcare, where I have spent many years. So I know about this domain. But the other domains are all also there, like agriculture is there. People are talking about precision agriculture, many things, precision fermentation to replace milk-based product. Supply chain is of course one of the area. Then transportation is another area. Metaverse security another area. So this you have to think about and align yourself career goals. I will solve this problem in future, and then you are a good faculty, consultant, or a student or PhD scholar in computer science. So the way we are going to see computer science is shifting, and that paradigm shift is required if you want to be successful in computer science. So that are some words to start with, and that's why when uh, Dr. Srivastav approached me about something related to data, then I told I can share my experience. And of course, there will be concept related to information system, data sharing, everything will be there. I will put that also. It doesn't mean it's not going to be theoretical, but more practical oriented. So congratulations to Ashoka Institute for coming with some innovative means FDPs related to that. And that is their contribution in education, and I really appreciate that. So with this word we'll start. And health data management, veracity is means otherwise the data is good, this chat GPT all will be useless, and people will actually um, lose interest in these things, and this will remain buzzword. Same is problem with metaverse also. It's a hype. If you have time to go through technology hype cycle of Gartner, you will come to know many things about this. So keep your eye open and start, and then align with a problem solving. Become a problem solver in computer science, not a coder. You will be having a great career, and that I can assure. So with this, what will start. So veracity is one thing. Interoperability thing, system thinking approach is not there. One data you create somewhere, it cannot be used in other place. Devices are not communicating well. That is interoperability. And the biggest concern to digital health these days is even governance with Aadhaar card and everything. So privacy and security concern, how to address that? Is there any solution? And of course, there are technologies like blockchain is there, how it works, sandboxing techniques, not only new technology like blockchain, how you are using that, the approach of sandboxing in technology, that all I will discuss. So don't worry about that. So veracity, interoperability, privacy, and security concern for related to health data. And but the things I'm mentioning, it's not only related to healthcare, it's related to agriculture also, transportation also, any banking also. So that is the thing. And uh, now, next 1.5 hours, I think is going to be. So I will discuss healthcare system and complexity, because I don't think you are a consider means maybe you will be better knowledgeable person than me on healthcare, but healthcare system and complexity. Why IT is actually required? No, digital transformation in healthcare. This is very close to my heart. Data is the new fuel in business. We talk about always then, like, but you understand why it's a new fuel in business. Unless it is solving the real problem, the data is useless. This is garbage in, garbage out. Common use of health data, how you use it in healthcare. Digital health from EHR to precision care. EHR is electronic health record, and this is implemented by Ayushman Bharat Digital Mission, and many challenges are there. We came up with Ava ID. People are not apprehensive to share their information. Then we did not make it mandatory to use EHR in Ayushman Bharat PMJ. We made it voluntarily. So this was half-hearted effort. Government could have made it mandatory. With that, I feel. So sometime explicit approach works better than implicit and convincing people. Sometimes there should be mandate for good thing. And this government is right in many way in that, and we'll realize later that this digital mission, Ayushman Bharat, how this changed the dynamics in healthcare in India, and this will be a great case study. So align your career, how this digital health mission will be a boom, and how you can contribute as a computer science graduate, either in AI capability or making product capability or service excellence capability. So you align yourself with business problem solving, and business problem is always those problems which customer face. Always align yourself to the computer. So I find this, there is a disconnect between engineering and business and management and society. That should not be there. And that's where the people like me comes into picture, who have not only been in engineering but also management, faced problem when they establish their own business. They realize the real problems are. So from our mistakes many people can learn. So that's why I'm always ready to help. So health data management, so because this is a academic session, so I will talk about this, what are the benefits of health data management, health data management challenges, and what is HIPAA, Health Insurance Portability and Accountability Act, which actually ensures data privacy and security in country like US and Canada, of course, has different. Then we came up with Digital Information Security in Healthcare Act, DISA, in 2009 by Indian government, but somehow we were not able to enforce it into policy decision making because of lack of awareness and something like that. Privacy and security issue and blockchain actually came into picture, and it is actually evolving. So actual contribution of blockchain is not into cryptocurrency. Of course it will be there when we will be seeing direct benefit transfer and removal of intermediaries in healthcare financing. Of course that will be, but right now can we ensure privacy and security issue, and that will be great addition, huge case of blockchain in health financing. So that is the case. Large language models and chat GPT, you go there. From now onwards, in my class today, I declared I will not use Turnitin to check your plagiarism. I will not check that you have copied from somewhere. You come up with information. We will discuss that information is correct or not. We'll further explore whether some right reference for that information is there or not, because I cannot stop students from using chat gpt. If I will not include chat gpt in my classroom, a student will find a way to use chat gpt in their assignments, and that will be actually detrimental. So why not I introduced Chat GPT in my classes. So I made it, you prepared presentations using Chat GPT, but we will discuss that in class. So there I can ensure also that whether they are presenting is means accurate or not, and we will discuss further. and that will engage in class also. So I actually completely changed from assignment model to presentation and co-creation of content using flipping the class concept. So that will be because it's FDP faculties are there. You can take a note from here how we can do that. So not only I am the person who is using this type of large language modulars in technology in classroom discussion. Wharton faculty has already done that. Many are pro that, many are against that. That is debatable. But this large language modeler, they are good only if they are trained on actual data because it is a supervised learning system. So that is the concern, and how to do that, that is debatable, but start using this. Ayushman Bharat Digital Minister already I talked about, and then some cases discussion on health information system. If time permits, I will be doing that also. So with this agenda, I will move to first thing which I say that because why you should connect with in healthcare, we are not coder as a computer scientist. We are actually solving a problem, and the problem is main is you are transforming the bad physiological state of a patient into good physiological state, and achieving that there may be many things, supply chain problem, diagnosis problem, anything, and computer science comes very handy driven by data science and AI capability at there. So you become the enabler of those technologies. So this there will be always input in any industry, and there will be output in terms of goods and services. Of course, in healthcare, that is services. So transformation process, you facilitate it, you make it better, you make more value addition, you reduce inefficiency, you make service excellence better, and that can be done utilizing data. And data can be managed only through this data scientist, and no one is more capable than doing that other than this computer science graduate. So that's why you people are very important asset for healthcare system, more than doctors in near future. So be ready for that, and doctors role will change, they will become domain expert, and every manual thing will be done by these computers. And so things are there, many ethical concerns are there, but the thing will work only when there will be right data, otherwise there will be garbage in, garbage out. So how to ensure that, and many things are there that will be discussed in this session. Now the basic health system looks like that. Patient is there, health service agent or hospital is there. The patient gives money, request for service, and services are being delivered to patient. So this is simple healthcare system, but things are not this simple. You think about this statement I'm making, and you can quote it anywhere. 80% of the cases in healthcare, the determinants are not related to your genes and your phenotype and your mm, other thing, biological factors, real more related to social factors. So those are called social determinants of healthcare. So that data is also important, but that is not taking into account for clinical decision making. 80% of the case things you are ignoring. Your more hospital are only focused on 20%. Now come to that 20%. Role of doctor is only on 20%, not 80%. The role of clinical nurse, role of management, financing, everything is there. So doctor is a part of 4% of that. Now this doctor is very important cog in will because they are researcher, they are everything. But think about only doctor focus system, is it going to work? No, it's not holistic. It's totally against. That's why so much inefficiency in healthcare. And in US we term this term as a value crisis in healthcare. And that's why Michael E. Porter, if you are aware about, if you have any exposure of value chain and management, you will come to know that there is a value crisis. There should be a value agenda. Value agenda will be about improving the outcome, reducing the cost. And here this value is defined at outcome divided by cost. So value maximization you can do either by reducing cost or making improve outcome better. And both where IT plays a very, very important role. And it's not possible because you are as good as data is. So that's why data is very, very important. And that's why this type of uh, discussion is being done here. Now you make it more. This is physician, nurse, administrator, patient, allied health, pharmacist, emergency system performance, non-linear interaction. I will not go into that detail because I take separate session on that system thinking. I propose to Dr. Srivastav, also your director, that we will be having a session on system thinking maybe in June, if you people will be available, and I will be happy to deliver that session. So non-linear interaction, I'm not going complex adaptive system, I'm not going, but the only thing is the system, healthcare system we say is a complex system. Many elements are there. The roles is very loosely defined, and it's adaptive. It changes day by day. So complex, adaptive, dynamic systems are there. Now, if I don't know, you can answer my question or not. I only generally ask this question to everyone, that is complexity good or bad? So if anyone can answer, and if the organization can facilitate the interaction, can anyone answer this question? Is the complexity good or bad? Because you will actually. So anyone? Anyone having any insight on that? Is complexity good or bad? No response. Okay, no problem. It's kind of complexity you cannot avoid. Your body is
Like that.
complex. Yes. Yes. Yes, sir.
Yes,
I wanted to
Nelson.
listen you. Yep.
But I think complexity should be there so that anything's difficulty can be find out.
Very good, sir. The thing is, you cannot avoid complexity. The things are complex. No? And if you simulate a system also using only generalization or simplification, that is of no use. No. So complexity will be there in system simulation also. Then only it will mimic the real thing, and then you can get some. That's why we talk about digital twins and everything. So that should be. So complexity you cannot avoid. We are sure on this. What about complication? What you understand by complication? So complication is something, the complexity which is not required. Okay. So we cannot do anything about complexity, but of course, we can do about complications. So always avoid complications. So never use many, if you are mobile app developer, never give more uh, features than required. That actually make things complicated. No. So always be frugal. That is a different topic. So the thing is complexity is there. So now the complexity is required, and complexity is driver of business profitability. You will solve complex problem, then only you can actually demand money. So it's a business, and it's all data driven in healthcare. So we have limitation. Data was there. Things were complex. The data was not were loosely defined. So privacy concern, security concern. So there actually roll out. IT comes into picture. IT can play an important role, information technology, in addressing this complexity in healthcare systems. So that's why I always advocate digitalization in healthcare. Again, simply example is Michael E. Porter talk about integrated practice unit. He actually emphasize, if you have anyone have any idea, because most of us in India suffer from migraine or diabetes or something like this. So diabetes is not a disease, it's a group, it's a condition in which multiple organization will be affected. Organs, sorry, organized organs will be affected. We call that comorbidity. You need an integrated team. Integrated team will be doing that. So it's lot require a lot of investment. Your outcome improves, but your cost increases significantly, and patient will not be able to afford because cost is high. So IT can actually integrate. People are at different location, and they can communicate with each other using EHR and everything. So expertise is also available. Telemedicine can come into thing, and we can have best of both world, means integrated practice units are also there, and cost is also not that high. So that is the beauty of IT. That's why I always advocate use of technology in healthcare, but I always discourage the use of excessive technology, unnecessary technology, making things complicated in healthcare, launching, and I will come to that. If you go to Shark Tank and anything, I will come to that also. So actually, the thing is making complicated will require more resources. You will think I have created great solution, but it's not, and don't have value to customer, and customer have to pay. Actually, that is the person, patient actually pays. So data driven insight you have, you find out what my customer want and you can do that. But for that you need to manage data properly. Privacy security concerns should be addressed, data should be right. So the concept of value crisis, value agenda, I can talk on this for means I take this value agenda class only for 30 hours in management. So this is the different thing. We will discuss something, but the only this is, if we want integrated practice unit concept proposed by Michael E. Porter to be successful, your EHR and telemedicine plays very important role. And EHR is related to data management. And who will be doing that? And that will be the computer science person. So their role will shift from coding for being a means what you say resource in a BPO where your expertise is being utilized for cost arbitrage. Resources costly in US and resources cheaper in India. People will be hired and you will be feeling very happy when you are going on site, and then someday your utility will not be there and people will fire you. So don't go into that. And then you will not, you will have wasted your whole life and you will not realize that now you cannot learn and do that, then something else. So that we call midlife crisis. So understanding what you are solving using data is very important. I will not go into that because I have time limitations. So the next is what is complexity. Already I discussed detailed complexity, dynamic complexity. I discussed system. You know, system are many element interacting with each other and collectively they are delivering something. There can be constructive and destructive interference in system. So it's possible. So complexity I discussed. Driver of complexity, numerousness, variety, diversity, interconnectedness, opacity of interaction. So data is not loosely defined. Dynamic effect, data is evolving also. Sometime when we go and we gather data and data is getting changed itself. So whenever they call go for longitudinal randomized control trial or something like that, not cons, then I always advocate, if you are going for longitudinal data and you're not getting right data, or sometimes you are going cross sectional data and taking too much time and data itself is getting changed. So what is use of that? So utilize big data and data driven medicine. You go for that. Even you are 90% accurate, utilize that, use in time and save life of people. So that's why it's very important. So it's written for supply chain, but it's, so why we care? Because complexity is important. We need to address that, and value will be more if the IT is implemented there. Now it's coming to that healthcare information systems. So these are integrated effort to collect, process, report, and use health information or data and knowledge to influence policy making. This WHO told in 2000 and it's still relevant. These are a state of interrelated component working together to gather, retrieve, process, store, and disseminate information to support the activities of health system. And objective is, of course, to increase value in the system. And you can do that. So decision science and supply chain, or especially my area is healthcare supply chain, these two are very much correlated. Without this decision science, without decision tree, without this AI, we cannot solve many inefficiency problem in supply chain. That's why this course is. So property of the system, I will keep it, skip it. I will share slides. You can go to HIS for system lens. So people, procedure, culture, and processes, activities, everything is there. So this is behavioral system, and technology system is hardware, software, network, and data. Now, the another insight from my side is for you. This technological subsystem is 20% only, and behavioral subsystem is 80%. If you make a very good model and people have behavioral problem to modify data and provide misleading information, you cannot do anything. So that is 80% important. So you need to understand this behavioral subsystem of health information system. So this session is to sensitize you about that. So it's not about all hardware, software, network, and data. It's all about why this data is not right, how to structure the data, how to address people's apprehension toward that their privacy will be compromised. Use that and use masked data. So this is the thing. So HIS required, any health organization entity required data in order to assess the impact of organization intervention, prioritize policy and strategy, adopt to reform. You people know this, obtain information pertinent to new styles, participation and location service management and decision making is required slot technique management things, but HIS is required. I think I was able to drive that point. Why country need HIS? To apply performance-based resource allocation. That actually Ayushman Bharat scheme is doing. So the people in future, the hospital performing well will be paid more compared. So in NIRF ranking we are doing in education system. Why we are doing? Why we are going for next? So we are using data and performance-based resource allocation. So the organization which are higher NIRF ranking, they can demand, they will be given preference to get fund for there. So that's why participation in NIRF or quality in your health education system is required to get funding in near future for your projects. So that is required and that is ongoing process. You cannot achieve that in one day, but if your orientation will be there and leadership think in that direction, one day you will of course do that. So to understand and influence how the healthcare service delivery operates, assess coverage quality to fulfill donor requirements. Sometime with that, and donor is if your means HIS is good, then only this World Bank and this WHO and Bill and Melinda Gates Foundation and many are there. They invest in your. So if that is required to asset development money, of course, from World Bank had to monitor progress toward major international goals, to build and maintain efficient healthcare services, to respond to public calls for transparency and accountability. People are now more aware and medical legal cases are increasing. They want transparency in everything. How my money was utilized. If I paid 50,000 in hospital, what were the heads and whether I was money was extorted from my side. So mistrust was there. So actual data and transparency is the thing which can solve this lack of trust issue in healthcare. So especially private hospitals face that lack of trust issue. And I was a CEO of a hospital for 6 years. So from my personal anecdotal evidence, I can say that. So that is major problem. So data and analysis and transparency, that is not possible without proper analysis dashboard and involving all stakeholders sharing those information and involve your patients also that this we are doing and that we are doing. So benefit of HIS, helping decision maker, empowering individual like patients and communities, and strengthening the evidence based on effective health policies. Okay, a scale of effort, enabling innovation through research. If you have data, if it is in proper fashion, if it is masked, it can be used for clinical trial. And that's how we achieved vaccine discovery process for corona in regardless time. Because there we went for a distributed randomized control trial. We always um, used to enroll patient into centers for randomized control trial. Now in this time, what happened? Data was kept in the central repository and hospitals and researcher went to people who are suffering from corona and quarantine at their home and data was taken from there. So this was not possible without better data management, transparency, healthcare information system. So these are the benefit of HIS. Improving governance, mobilizing new resources, saving resources also. So the money you save is also money you earn. So IT can contribute there. So these are the things. HIS, how will we know when we get there? Monitoring and evaluation, data driven, of course. Where are we now? That is also data driven. How we will be there? Development and intervention, identification of resources, and setting priorities and target. Anything, these four goals are set by WHO, and health information system plays a very, very important role. And this is not possible without right data, right procedure for storing data, right technology, and of course, more than that, right talent like you people, right faculty who can teach those talents. So that's why it's very important. What kind of data flow in HIS? Now we are moving little more toward data management because the context I have set till now So birth morbidity, mortality data is there. So this is fine. This data is historically stored in legacy system, but it was not available to everyone. Type and location of health personnel. This is also who is available, which type of skill is available. So if we matching that also using e-Sanjeevani platform, like Dr. Sanjay is my friend, is Sanjeevani, and then this project implementation. So if you know where people are there, patient, and where the doctor is there, and that data is there, you can map that. Type and quality of clinical service provided at national and sub-national level that can be improved, and population integrated demographics and socio-economic status. So in future, take my words, this census we do after 10 year will not be there, because every data through this Abha ID and Aadhaar card will be getting updated in real time. So there will be no need of this census. So census will be going, and huge money will be saved. Huge money will be saved. And not only the data will be available in real time, accuracy will be also ascertained, because I have personally seen the people who are doing census, they come to your home and they ask questions like how many people, how many children, how in earning and something, they ask that. And if the next door person is not available, what they will do, they will ask the same information from some other source, they will just take and they will go. So this is behavioral issue. That why in HIS I was discussing about behavioral health system. So if directly every transaction is being monitored and the data is getting stored, so you don't need foot on street. Also, money is also saved and data veracity is also saved. And now the idea is to make technology interoperable. That so same data with can be ethically utilized for different things like randomized control trial, allocation of fund, planning of resources. You think about if many doctors are there and Yogi Adityanath, our chief minister, honorable chief minister, know that he will be having better meeting. He will be having better idea in which part of Uttar Pradesh there should be a medical college, not driven by only ad hocism that open one hospital, one college in Chandauli, open one this on that. But it's only data driven. So policies can be improved if right kind of data is there. That's why I always advocate Ayushman Bharat Digital Mission, although there are certain shortcomings, but it will change the future of healthcare in India. And we are fortunate that we are going to witness that. And we will be more fortunate that we will be able to contribute to the growth of our nation in any capacity. So the CEO of Ayushman Bharat Digital Mission, R.S. Sharma, is there, and they organized one workshop and I was attending there, then interaction during. Then I told sir, if anything related to ABDM you want from my side, free of cost also, I will find myself lucky to contribute awareness session at least on this. And he told, yes, we will be doing that. So it's all about nation building doesn't mean that you shout slogan. You are data scientist, you are computer scientist, use computer science and data analysis to actually hit the pain area of the nation. That will be your contribution in nation building. And that's why education institution can play a very important role. So this is, I can go on and on. Don't So domain of health data is health determinants, and that I told social determinant of healthcare. Health system inputs, how much money is spent, how much means doctor is getting paid, how much on medical insurance and everything. Health system outputs are in terms of morbidity and patient getting cured and everything like that. Health system outputs are that, and outcomes are driven by means how many people's quality of life. We in healthcare we talk a term quality of life year added means if we went for some intervention and treatment, how we actually improve the quality of patients. So if suppose diabetic patient is living with 60 year, and if the person with some treatment he's doing all his work and then he's living for some 70 years, not only we are improving the quantity of life but also we are improving the quality of life. So quali dalis are different measures. So I'm not saying you understand everything, but you understand what is the philosophy behind that. Health status, we come up with global disease burden, Very unfortunate that after this 150 year that Snowman did about the handle pump analysis from where epidemiology came into like cholera outbreak, and cholera is resurfacing. Proper analysis is not there. Proper insight is not there. We don't know. Another thing I will add before I will go to next, because you people, what do you think? Immunization of polio should be continued? If I ask this question, the answer is yes or no. We don't know because data is not there. But I have some data. We are doing some research, and that suggests that excessive use of polio vaccination in India is actually resulting in some means unintended consequences in terms of means side effect, if you in layman's language call about. So now it's time for polio to not be mass immunization but precision immunization. Now, who will provide this information if health data is not there and analyzed properly? You people will be doing that. So you people will be doing that, or you people will be training other people to do that, and that will be your contribution in means nation building through healthcare. So topology of measurement domains, already this health system inputs, health system outputs. Yes. Health system outcomes, health status, you can contribute in any domain. So you do that. And the next one is uh, 30 minutes. So health determinant indicators, already we talk about prevalence and level of poverty, education level, water and sanitation coverage, infant mortality rate, old mortality rate, maternal mortality rate, life expectancy, prevalence incidence of infectious disease like corona, and of course, um, we are fortunate that we know that this outbreak is going to come, or this mutation of this corona is coming. Earlier, we never know that, and people were used to die. So we are fortunate that we can do, and you contribute using that. And healthcare resources allocation indicators, I will not talk about. I will share this slide. You can go through healthcare utilization indicator. This is the area where I work very, because I have certain limitation. I'm not doctor, but I have developed some skill on the basis of my experience. But if I would have been uh, a doctor and this technology capability or understanding, I would have made significant contribution in other. But I have find out that healthcare utilization indicator here I can work. Immunization coverage I am working on. Uh, um, Antenatal child and maternal health, I am doing that. Proportion of birth attended by skilled attendant, yes, we are doing that. Contraceptive, we are doing that. So you can contribute in there, and funding is available. If you are faculty also, you want to make career, everything is there in this area. Don't worry about that. And the main determinants of health: environment, health service delivery system, community. We all talk about this. And environment, health service delivery system, community. This is types of health information system. So strategic information system, this you people will be more interested in artificial intelligence, where we come up with decision support system, simulation system, financial forecasting, performance assessment. People mostly work in this area, and there is great demand for job. Typical information system, MIS, is has been there, but it can provide a good information. But the things will start from here. EHR, we at as a country, we are not even good at this EHR level, and that's why ABDM came up with EHR concept and everything. So this is the case. So we are not here, and we are targeting about the topmost of the pyramid. You do that, we aim for high also, but we correct the fundamentals, and that's why this session and that's why this lecture is about typical organization structure of HIS. This ministry is there, other sector, insurance, private sector, disease surveillance, facility, researchers, donors. Researcher you can chip in for their department of statistics. Department of statistics nowadays and department of mathematics is more toward computational facility only. I have seen the sea change in department of mathematics in that was department of applied mathematics in IIT BHU. It became department of mathematical science, more toward computing. Same was statistics department in Institute of Science BHU. They also transformed themselves more towards computational capabilities. So computer science and this data, and of course statistics you will be using whenever you will be talking about any machine learning and anything. So this I have written Department of Statistics, but Department of Computer Science is also fitting very well. Health information subsystems, data collection based on patient and service record, program specific monitoring and evaluation, administration and resource management, disease surveillance. These all I talked about. I will skip this. So relation between different, so many things are there. Or and here see raw data is very important. Information subsystem is there. Accountability is one thing where I stress very much. Unless accountability will be there from anyone, and technology can do policing using, we are talking about blockchain and other things, but it's fine. So internal accountability, external accountability, everything needs to be restored, and we need to have a strategic plan. And the country is lucky, under the guidance of Prime Minister, this ABDMK, Ayushman Bharat Digital Mission. It was not going to be the case if Corona would had been there. This was ABDM was actually influenced by success of UPI in India after this demonetization. It is debatable that demonetization was good or bad, but when people ask me, I always said because of demonetization, we started using digital technology and UPI, and from there, this policymaker thought about to coming with ABDM. So ABDM, this confidence came, and now we moved to our ABHA and nationwide EHR and PHR implementation. We thought about that was triggered from demonetization. So what happened with demonetization, whether it's right or wrong, that is different area. It's not my expertise, but this demonetization contributed in the growth of digital health in India. Second thing was this Corona. If someone asks you what happened to best thing to computer science person for healthcare, so that was Corona. The things got digitalized. People started using telemedicine. Now role of data is getting generated because of the wearable technology like IoT and everything, home monitoring increase. Think about who thought about using pulse oximeter 4 years back in their room. I have always seen that pulse oximeter when person was in ICU, not even in general ward. So this came to your home. Now people are thinking about handheld ultrasound, ambulatory blood pressure monitoring, CGMS is already there, continuous glucose monitoring devices, glucometer already you are doing. These all are generating data, and they need to be analyzed. And this all for this we say thanks to Corona. So God, whatever God does, that has certain purpose. So because of that, the system evolved, and this healthcare data management and everything came into limelight. And then we thought about the potential, and the government come up with Ayushman Bharat Digital Mission. So, but there is accountability issue, process issue, inefficiency issue, resource issue, and talent issue in this. And that's why this type of sessions are very important. Will sensitize. I cannot teach you Python in 2 hours. Maybe you people will be knowing better Python or method any programming, because I started my programming from COBOL and Python. From Fortran, sorry. Then I did C, C Sharp, and I stopped there because I came into industry, and then manager I became. And then long after a hiatus of some 7, 8, 9 years, then I started learning R. Then I would realize that R is the language for statistics. Then things changed. People started saying that you learn Python. So then I started learning Python. Then I realized the people whom I'm saying, these people do actually they need to write code. Then I came up with idea like why not to use KNIME, KNIME, this GUI based software for machine learning. So when I introduced a subject in PGPM program in 4 around healthcare management and analytics, we talked about KNIME, zero coding. So we did that, and people were very, and means your doctors were there, they were able to use. So have you thought about 1 year program making a doctor capable to do machine learning, ANN, deep learning using a tool 9, we were able to do that. So this is the thing. Things evolve, things evolve. Things which are not possible today will not be possible in future. It's not true. Always be, I mean, no, don't face marketing myopia. Theodore Levitt talked about in his HBR article. So why Kodak fail, and why this digital camera came into picture, and the Kodak have to shift their business model. So everything. So is applied to personal level also. You think about it, otherwise you will be extinct, and then someone will fire you, and then will start repenting. why I was not aware about these things. Though you leave the company, you contribute on your terms. You become a means contributor, problem solver. No one is going to fire you. You leave company, so become empowered. So what is big data? Now, after so much discussion and context, and I have half an hour. Sorry, more. So big data refers to extremely large and complex data set. Of all of you know this thing. These data sets are often generated from wide variety of sources, social media, online traction, sensor data. I'm very specifically interested in, and scientific experiment. Big data usually refer to volume, variety, and velocity. Already you people, this is more cliche kind of volume, variety, and velocity. So volume, variety, and velocity is fine. You add one other term which I actually use in my title, that is veracity. Unless veracity is there, this big data is of no use. So volume, variety, velocity, and veracity of the data is required. And to process big data, specialized technologies and approaches such as distributed computing and machine learning are often utilized. It analyzed properly, big data can help us and provide superlative care. So common use of healthcare data, clinical research. Already I have told you about vaccine development and cancer. We talk about precision medicine and many things like we do that. Quality improvement in healthcare. So it doesn't mean that you are not medical person, you cannot use data. Okay, of course, you are a computer science graduate. You actually in Ashoka only you collaborate with management person who work in quality, and how you can solve a quality problem in healthcare in an uh, hospital environment. See, so you take this project and use it as a case. Then Ashoka will contribution will be there because you are in Varanasi. You find out a hospital in if you are not able to find out, I will help you to find out that hospital. You find out that hospital, their quality improvement initiative using data management. How you can do that? Computer science and industrial engineering department, if not there, or operation management, you do a joint project on that and you publish paper. Not only paper is required, of course, but you solve their problem. You write a case-based paper and you publish it. It's good for your institute, good for you, and good for hospital. That is contribution. Academics, population health management. Healthcare data can be used to identify and track health trend in specific population. Intervention to improve overall health outcomes. So these are certain use. Billing and reimbursement. So many frauds are there. So detecting fraud, that inappropriate use of medical insurance is there. You can find out that. So we can do that. And they can do that. Medical education and training, healthcare data can be used to train medical student and educate healthcare professional on best practices and emerging trend in field. So it's being done, and of course, medical. Wish I one day your college will be also having medical college something. So, but it's not like that. If you don't have medical college, you cannot contribute into healthcare. I told you this 80% of healthcare is not medical college related. So you go there, contribute. Personalized medicine, your role of a data scientist will be huge. People started using that data scientist. One person is there, Baikal Alhabtur, CEO, Raj Sandhu. His business profile is chief business scientist, not CEO. People are taking pride in big solving problem using data science. So your students someday, if Ashoka can produce a person who is chief business scientist, kind of person, that will be your contribution to society. Some company comes from Ashoka. You never know. The people who know the problem can provide the better solution. And one or more update, I'm a B Hub. This is Bihar Hub, and of course, you all people will be knowing about PK Mishra sir and his contribution in entrepreneurship development in Eastern UP and of course whole UP. Similarly, Bihar is coming with B Hub, and I'm involved with their initiative to do that entrepreneurship and use of technologies in healthcare. And I'm actually exploring also in agriculture also up to some extent. So you think about contribute into society and translate that contribution into your personal growth also in terms of paper, in terms of publications, so that NIR ranking of Ashoka improves. You get more, not only Ashoka, from wherever you people are improves, and you get funding so that you can do more work, because um, no one is going to fund you unless you solve a real problem and they have benefit from you. So you do that. So you precision medicine is one area because data and precision medicine are closely related, and precision medicine relies heavily on data to make personalized treatment decision for individual. Already I told this include data on a patient genetic makeup, medical history, response to treatment, and I will not go into that. About by analyzing large amount of data, healthcare provider can identify pattern and make more informed decision about a patient care, leading to better outcomes and more efficient use. So better outcome and efficient use, cost is less. So value is actually increasing. So same thing which Michael reported asked or told that there is a value crisis in US system and we need a value agenda that can be achievable using data driven medicine, and that's where you can contribute. You can start contributing in any capacity. Write white paper, write case study, write research paper, train people, take MDP. Initially you will be not able to publish in a good journal because maybe your idea will be too innovative or you are not that known. You write book chapter in Scopus Index journals, then you build your profile, you publish then in good journals. Contribute, make your college proud, make your region proud, make your contribution. So that is example of precision medicine. Precision medicine breaking new ground in personalized cancer diagnostic. I'm doing a research in here in UAE. Most probably I'll get funding, Al Jalila Foundation. So personalized cancer diagnostic. So diabetes drug specialization on basis of phenotype and digital biomarker, that is very close to me. Precision immunization and mass immunization for polio. We are doing a paper on that. Rise of wearable and other devices are generating plethora of data, and that we can be analyzed. Data can be to provide customized care. It is really required in all cases. Cost benefit analysis of health technology assessment, and this is a course I teach actually. That is health technology assessment. Every technology should not be included in healthcare because that will increase the cost of care. So suppose you introduce a technology and doctor is using that and they are charging 1,000 rupee for that, and it's not adding any value in treatment, cost of care will increase. So there should be proper cost benefit analysis of any technology. So how that is possible? If you have proper data, economic data, spending data, outcome data. Without that, health technology assessment is not possible. So that's why um, 5 health data management benefits. Create a comprehensive view of patient, household, and patient group. I will not repeat this thing. Improve patient engagement. There will be more medical adherence, predictive modeling, risk prediction, improve health outcomes, track health trend in certain areas among a specific population, predict new trend, and suggest proactive measure to counter rising health issues. These are the, and then business decision making, of course. See, okay, I will not discuss that. So again, take 15 minutes. But these are the things: business decision making, quality improvement, financial analysis, supply chain visibility. In pharmacy, you are saying the visibility, the data analysis to get whether the which type of medicine will move. You can find out those medicine and stock it so that your business will be good, profit making. So this will be done in the healthcare house. Analyze physician activity, means such as a success rate, time invested in different treatment. And if any one of you have any interest in accounting, they must have heard about the concept of time-based, time-driven activity-based costing that can be done to find out resource utilization in healthcare. So that is not possible unless real data is there. So that's the thing. Then 3 health data management challenges. The data is fragmented. Data is fragmented. If you address that problem, medical data can be structured data in spreadsheet, database, somewhere it is in paper. Even in UK, NHS is having that fragmented data. Somewhere it is video file like ultrasound. Somewhere it is digital document. Somewhere it is scanned paper. MRI data is different format. CT scan is in different format. So healthcare data is very difficult, and it's a fragmented data. So that is challenge. So digitalization of the data in itself is the greatest challenge in healthcare. So if a company is in Varanasi which digitalize every type of data of a patient for a hospitalization as a BPO, they can make money. So it's not like coming up with AI driven some big tool and getting funding. You can contribute. You can start a 5-seater BPO which digitalize data into format. Initially, it will be manual, then it will be automated, and the company will be successful. So they are solving because you are solving the real challenge in healthcare, which is a fragmented data. And I know many companies which started from digitalization effort and now they are full-fledged AI driven companies. So think about it. Changes to data. Medical record constantly changes as do the names, profession, location, condition, because diseases are evolving, and we call in diabetes also that is progression of disease. In disease that is applicable. So the health status of person is not static; it's a dynamic. So undergo numerous tests and administered many type of treatments. So only starting with registering the data is not sufficient. Updating it and ensuring its timeliness and accuracy is very important. So one was fragmented and then dynamic data is dynamic, changes to data are there. Now this is the biggest area which will stop you to venture into any business in health data management, that is regulation and compliance. So medical data is very sensitive and there are government regulations. In USA, it is called HIPAA, Health Insurance Portability and Accountability Act. Its name is little misguiding because it came because insurance companies requirement were there about that, but now it is related to managing every type of data. So data discovery challenges and poor data quality make it much more difficult to perform required audit and meet regulatory requirement and limit the diversity of data healthcare providers can use for benefit of patients. So HIPAA is required. So HIPAA in many countries there are HIPAA counterparts, substitutes. Our country also came up with idea of DISA, DISHA, digital means health account or something. But in 2009 we debated that policy is also there if you find on internet, but we were not able to implement it. Why? So I don't know. So if someone of you is a computer scientist and think from this lectures angle, this regulation and compliances, why this DISA was not implemented, or whether there were motivation problem or whether there were technical problem or people adoption problem. You write a paper on this, you publish it. Means you can do anything. So it's kind of type of interoperability in healthcare. Now I'm coming to, so veracity and done. So good data is there, then only you can actually make difference and you can do wonders using data, provided that data is accurate. So volume, velocity, everything is fine, but veracity is very important. Type of interoperability in healthcare, lack of interoperability between healthcare system and reinforce information in silos. It cannot be utilized and exist totally in paper-based medical files. So interoperability, people will get frustrated if you are storing data in computer science computers and it is not getting used somewhere. Then people will think, what is used? Why I keep in computer? I will keep it into files, paper file, and the person who can work on computer is costly compared to the person who can do in manual. I will save my money there. People's motivation will not be there if it cannot, the data cannot freely flow. So promoting interoperability between information system and deal with sensitive information take the significant amount of time and require large multidisciplinary expert team. You need medical legal person, you need computer scientist person, you need IT infrastructure person, everything even sometimes finance guy to find out the cost benefit analysis. In general, there are several basic different level of interoperability, but because I in title have kept interoperability, that's why I will discuss it into some extent. Technical interoperability is the one thing. So level of data is exchanged across system using a communication protocol. So now you people know better than me what are this communication protocol. At the plug and play signal protocol level, technical interoperability established harmonization across different systems. Then there came syntactic interoperability, the capacity of the two or more systems to share data and services using a common interoperability protocol like high level architecture. So you teach these things in your DMS lectures, so you people are better informed about that than me. Pragmatic interoperability is when interoperability systems are aware of one's other's process and procedure, and the level of interoperability is attained. And this means that participating system comprehend the data's use of the context in which you use. So why actually this data is you being used, your processes are aligned to that or not. That is pragmatic interoperability. Dynamic is, again, I told everything is changing. Two or more systems are considered to have achieved dynamic interoperability when they can understand and take advantage of state changes in assumption and limitation they are making over time. It's like a marriage. No, people do people marry, they are not same after 20, 30 years, but they have a dynamic interoperability. The both are changing, and that is the success behind that is a recipe behind a successful marriage, dynamic interoperability. So this concept will never actually forget, because this is very linked to success in every part of life. Conceptual interoperability, when the assumption and restriction of meaningful of traction and our reality are aligned, conceptual interoperability is achieved. So then there is structural multimedia. I told every type of information is there. Multimedia information is there. Um, Object-oriented data are there, and form of information is recorded, and how it can be used across the system. Functional interoperability, they are there. Um, Consistent and established measures, same means function are performing. Then the last one is semantic interoperability, when two or more systems actually comprehend meaningful and correct information and transform in order to deliver useful results as derived by system and users. So these are the 8 interoperability defined, and of course you will be having this slide, and you all know there are available open source books and there are resources you can find out. If you'll on YouTube also, you will only you find out some even Georgia Tech interoperability lectures are there. You can find out from there also further. But my objective is to sensitize you about this 8 interoperability issue in healthcare data, and that can be further investigated by you people, because I am a engineer, industrial engineer, electronic engineer, had interest in computer science and data science, working in healthcare. But you people are actual expert, maybe better than me to do that. So you can do further. And now you in your colleges, wherever you are going, Ashoka or any other institute, you take session on this type of like fragmented data, how we can address interoperability issue in the data, how we can address, begin keeping example of education, hospital and everything. You do that. So interoperability challenge, technical challenges, organizational challenges, legal and regulatory challenge. Technical, already I have discussed this 8 were there. Organizational challenge, different healthcare organizations have a different policies and processes for data sharing, which can make it difficult to establish trust between organizations and share data. I will come to this point because I told you, behavioral subsystem of data, HIS is 80% compared to 20% is technical. So this technical challenges are 20% important. Organizational are very important, and legal and regulatory challenges, legal things comes while they are legal and regulatory, when ethics will not be there in anything. No. So there are 2 things in this world. One is called ethics and one is law. Ethics is our moral obligation and conduct. If we are ethical, law is never required. But we are not ethical inherently. We try to manipulate things. That's why there is a law, and there comes the legal and regulatory issues. And that makes our life even difficult. But you have to abide by the land of law, and legal and regulatory challenges will be there in interoperability. There are a variety of law. You people are even fortunate. You are in India. In here in UAE, there are 7 emirates, and every emirate had their different rule for this privacy security. They have different nodal agency. Think about a life of a hospital or in UAE. So if you are in Dubai, you are gone by Dubai law. If you are in Abu Dhabi, there is by Dubai law. The Sharjah, some different law. Ajman, different law. So very difficult. So mostly they have adopted HIPAA, but because it's a US standard, now we are having DISA. So in India, we'll be implementing DISA, but most of the Indian BPO, KPO doing business with USA, they need to align their processes according to HIPAA. So in future, there will be a thing in healthcare which is called medical tourism. So any hospital which need to utilize medical tourism and international insurance, they have to be HIPAA compliant in future. So HIPAA is very important, and you keep checking about DISA, how it's progress, and you write a paper on why DISA is not implemented till now and what you suggest to government. Be vocal in right direction, not on means Facebook, no, not on WhatsApp. Be vocal in right platform. We are academician. We can make um, this policies to that, contribute into that. It's been small thing. Your community level, your Varanasi level, what we can do. And if any one person is doing anything for Varanasi, not only Varanasi, Eastern UP, Bihar, or any area like that. So always you can approach to me for any input and other things. Maybe some of you will be better expert than me. I can also learn from you. So that thinking that financial challenges, of course, because interoperability is not easy. Everyone cannot implement blockchain-based solutions or like something. There will be financial challenges are there. So how to subsidize that by government policy and others. So these are the things. Cultural challenges. There are cultural difference between different healthcare organizations that can make it difficult to. As South hospitals are uh, more. I will give you another insight for 5 minutes. I will take for that. These are more process oriented. Our North Indian hospital, especially in UP, are not that. We only do those things which actually are legal requirement or regulatory requirements. So that is the one thing. One company is there, Ambupod, uh, in from Bangalore. They thought about going to get some investment and for their ambulance, telemedicine ambulance in different part of the country. So I was discussing with the founder of that, with Dr. Lavanya, and then the question came into my mind. I asked him one question: how many ambulance? He told me that he have many ambulance, like so the number was around 300-400. I told how many ambulance in Eastern UP and Bihar. So he was speechless. Then I told, you are trying to solve rural healthcare problem and you are not in Eastern UP and Bihar. So that is a big means. So you are in business, you are in not solving problem because you are not solving problem where actual problem is. So we are fortunate that in nation building, if you talk. So first thing is getting money for your profession and supporting your family, and then if you can contribute to growth of means nation is a big term. So if we are a little selfish also, can we contribute to Eastern UP or Bihar or Eastern UP at least, or maybe from Varanasi, at least you can contribute to Varanasi, improving. So improving this uh, processes of a hospital using analyzing healthcare data. Now the thing is, they will not give you money in first project only. So maybe pro bono, you do that. So then how to use that, because you invested time and money, you publish paper and publish in Scopus General, publish, you contribute. So utilize those thing in other, but you do that. Both thing is done solving the problem also. So it's a different thing. Cyber security challenge is the challenge. Let come the metaverse. I have already means getting some news and something in where the metaverse is implemented. There is a bullying. Bullying was there on Facebook also. Bullying was there on YouTube comment also. Bullying is everywhere. So analyzing the trend and so it's about the police and this you people, computer science people, have means requirement in army, you have in healthcare, very much in everywhere. Cyber security challenges will be the biggest issue, and who will solve this? So people like you. So that's why this MDP. So you can explore it further. So this is HIPAA. And I will not, because I have means 145 and 15 minute, 20 minute more. Okay, so HIPAA is something which is rule. No, I had certain standards, standard 1, standard 2, standard 3, standard 4, and I have written it all in here. PHI, whenever you see, that is personal healthcare information. And whenever I say masking the information, so privacy, you can address by de-identifying it. So you can do that. And HIPAA privacy rules I have written in this. Who must comply with HIPAA privacy rule? This is US guidelines taken from US book only. And I'm eagerly waiting from DISA guidelines to come so we can see what is required in India. So this is the rules, HIPAA rules I have written for you, and there's 6 rules. And here cases from same book. If you want the name of this book, I can give you later. Patient right, comment, document required, document recommended. So these are HIPAA, and these are HIPAA security rules. So privacy is done, security rules. What are the breach? If some breach is there, so you have to notify that also. Any breach of more than 500 records require notification on media, national media, in addition to the patient affected by the breach. It's not like someone data is breached and you are compensating that patient. No, you notify. So then other people will call to net that your this health information system was faulty. So if they have option not to share their information, they will be doing that. So fines are there and many things are there. So these are HIPAA rules, and HIPAA security rules, breach notification rules also I have set here, and you can go through that. Now that was about HIPAA, and India DISA will come. I have already hinted that, and you start exploring about DISA. No one is writing about DISA. You write a paper on DISA, okay? And a Digital Information Security in Healthcare Act, and this is DISA, DISHA Act in India. So the big this is some information is written here, but this is not clearly defined, and why it's not happening, I don't know. I also need to investigate that, but if any one of you is ready to write a paper on why this is, why this is required and what it will address, and so you can write, and I will provide input. So this is the thing, and DISA has proposed stringent penalties for defaulters in fine and other imprisonment also in India. And the most serious issue with data collection and sharing will be how to obtain informed consent from a data owner. And who is data owner? Actually, patient is there. So we are saying everything about EHR. The success is actually pegged on the 2 things, that is privacy and security. Of course, ease of use and cost is also important. So write a paper on that, prioritize these things using some multi-criteria decision making, which one is the most important. And if, believe me, if you'll ask a right person, privacy and security is the top priority. So if it is not there, no one will share information. That's why how to ensure that using computer science, that is your work. This portion, how, which is important, is already being done by this computer, this management people. Okay, of course, that is okay. But how to ensure that? So we will discuss that strategies. Then now this large language models, which is called LLM, and this is very much talked about topic these days, and people are writing paper. If your computer science department is not writing any paper on LLM, you are missing the boat. You can capitalize this buzz and you can write a paper and publish in a good information technology journal. So large language models in healthcare, data sources, care provider, institution, pharma, peer wearable sensor, publication, medical forum, X-ray, video, graph, table text, time series data on healthcare inflation, genomics, sequences, and everything. From there, you are getting this data and training is being done. And the modelers are there like ChatGPT and adoption. And what type of things you are getting? Interface to care providers. Now, ChatGPT for after my class, you go and you search ChatGPT, your test, you write. For me, I'm a patient of diabetes. Suppose I type 1200 kilocalorie diet chart for a diabetic patient having a mild renal complication. So if this information you'll write, this chat GPT will give you a diet plan. So that is care providers. But who will ensure that this is right? So there should be doctor. But think about nutritionist job is getting being made easy by this language and modelers. But the concern is if it is not trained by right data, the veracity is not maintained at initially, so the garbage in, garbage out. So that will be no use, and doctors and medical professional will lose interest in this, and this technology potential will be wasted. So large language models, interface for patient official question answering. Already I told, and so much frightened was Google. See this. If you believe in this rivalry between Microsoft and Google, Microsoft was looking for an opportunity to do something so that they become a number one in technology. Google is leading the ruling the roost, you can say. Now the thing is, OpenAI was one project. One of the founder was Elon Musk, and in 2000, Microsoft acquired Elon Musk stake in OpenAI, and then they come up with ChatGPT. This ChatGPT came into market. Now in Google, you search and you get data on the basis of many search possibilities are there. Which approach they are using Google, I don't know. But when we designed search engine in India during that time, we used using search and everything. So initially tag-based search we used to do. But the thing is, now you search in Google, you'll get search engine listing and you go there, from there you collect information. Chat GPT, you go type and question, it will give you all information using artificial intelligence, everything. So this is actually the end of the search engine as we used to know. So Google search is gone. It's not saying Google is gone. So Google need to align their capability into some other direction to tackle this substitution coming from the competitors. So what Google will do? Google fired people who were working on these type of technologies, and they are going to hire new people who will work on those type of technology like LLM for medical, LLM for education, LLM for history, LLM for humanities, LLM for whatever you think, entertainment. So they will need domain experts and different team. And this chat gpt become very popular in January this year only. So then half cooked solution of Google came, and that is medpol so they were developing stealth mode their own large language models, and they will launch it. So that is the future. Now, the problem with long language model is this is a supervised learning model. And if data is not good, which you are saying here, data sources are not reliable and modality data is fragmented. So if this is not there, then downstream tasks are actually value addition will be faulty. So this problem can be analyzed and solved for the better result. So that is one thing I am saying. This is one of the strategy. ABDM ecosystem. Now, if I don't have much time, so ABDM ecosystem is this complete ecosystem. This is taken from NHA website only. You can go there and visit. Citizen is at the central, and everyone is there. Now, see the stakeholders, which type of data is getting generated, and who need that data. You can align you to any industry, and you can make money. You can make contribute and nation building, whatever I say. So that is the case. Now, role of ABHA, Ayushman Bharat Health Account ID in digital mission is paramount important. It start with data. Health ID, you create unique identification of individual across healthcare provider. So interoperability will be there of data. Healthcare professional registry will be there. Health facility registry will be there. So professional and healthcare information is there. And now we talk about personal health record, and in that not only patient clinical information, but other information is also there. So these all information will be available and policy will be made accordingly. I told you, if our chief minister want to open a medical college, now in future he will take better informed decision basis of EHR and even exact location, and even chief minister can come up with plan which specialty hospital is required. So suppose if he get insight that diabetes is more prevalent in Gorakhpur, no, so and why to start a diabetes specialty hospital in Lucknow? Why not in Gorakhpur? So this type of information will come and future, and it will be very helpful in policy making, anything it will be helpful, but it will all be driven by this computer scientist, data scientist, and that's why this data courses. So blockchain, I always advocate. Veracity is a big plug problem. Interoperability is big problem. Latency is problem. These all will be solved by blockchain as a solution, because you all know distributed ledger technology is a must use term till now. It's a programmable, it's a secure, it's a anonymous, it is unanimous, it's a time stamp, immutable, distributed. So it's solving almost many problems of veracity and privacy and security and interoperability. That's why blockchain is the technology in healthcare data management, and a lot of money is being put in this direction. And another thing, this blockchain is not flawless. It is evolving. So the blockchain, the way you know, will be evolved in future. So better version of blockchain. So if you are a significant data scientist, you contribute in making blockchain better. That is one thing. If you are application oriented, you use a blockchain in problem solve solution. Okay. If you are more statistic oriented, you collect data, analyze, and you improve quality or waiting line, service efficiency, inefficiency of any hospital. So it's totally up to you. You find out your interest area, what actually give you kick. There was a film of Salman Khan where he was not getting any kick. So you get a kick and you do something. So this is the thing, and blockchain transaction are grouped into blocks. I will not hashing and everything. You know better than me. Um, Even sometime if I visit Ashoka, you teach me how to do that. I will be very grateful to you people. But I have listed down and you can go that. So security, privacy, interoperability, everything is solved by blockchain. And use of blockchain in, okay, this is one of the drawback of technology. When I type EHR always on my slides, it becomes her, because this Microsoft think that I'm wrong and they are right always. That's not the case. See, this is the drawback of technology. So I write EHR and they write her. So it's this her is EHR. So data sharing, data security, data integrity, veracity and problem, data interoperability, data ownership. HIPAA advocates the ownership of data should be with patient. And here we can make ensure in blockchain that this is actually ensured. And that's why all health records in this world are trying to become blockchain based, and blockchain application came into picture when where there was real issue of authenticity of vaccine. So vaccine passport problems came into. If you want to search about that, there is one of my article published on the role of blockchain in vaccine passports, so you can get some idea and you can continue from there. Data ownership and all things. So there is one concept in blockchain, and that is called data lake. So data lake is from different data sources. There will be data loader and data lake will be there. And and of course, this data lake can be taught for another 1 hour, so I will not go through. Data lake is a centralized repository designed to store, process, and secure large amount of structured, semi-structured, and unstructured data, which are fragmented in healthcare, and they were biggest problem. It can store data in native format, like CT scan is there, so in that format only, and MRI is there in that format only, and process any variety of it, ignoring size limits. So that's very useful. So data lake has application in blockchain integration, so you can utilize that. So introduce these things in your classroom study when you are teaching. Concept students can learn. Concept student can Google. This is about flipping the class. You give them articles to read, which are basic concepts, and you discuss applications. That will make your life very difficult because you have to be on foot always because you have to find out new things. So I am just suggesting another thing. Um, Share that burden with students. Let students also present. And now the same effort students are presenting, you are learning, you are giving your input and they are learning. And means book is there and that can be flipped. Everyone will come read the chapter and then they will come. Believe me, this I have introduced since 4 year in my teaching. And I never scored less than 95% in my student feedback. Never. It was 98 also. Sometimes people say that you bribe a student. It's not like that. So it never means you involve in co-creation of content and education, your feedback will always improve. So how to make your classroom effective? That is also one session I always take, flipping the class and everything, so that you get good feedback and good student feedback. So that is one thing. When I was in four, I always used to get uh, rating more than 4.9 out of 5. So, and here in Gulf Medical University, I always get more than 98%, 95%. So it's not like that you'll experiment, your rating will fall, a student will not, like a student will actually admire you. So data lake versus database, if you want to see the difference, data was store current data required to power application, data lake store current and historical data also. Is SQL a database? No, SQL is actually used in that. SQL meanwhile has remained in mainstay for many, but new technology will also come. Is data lake a extract, transform, and load tool? ETL is actually most common means tool and utilizing data lake. And now it's come to everything after that. The blockchain application is there, everything. This portion, behavioral health information system, I gave you hint that 80% importance, no, 80% importance. Even technology you are doing to check polishing so that people's behavior is maintained. You put this Kejriwal effort was there in uh, Chief Minister Kejriwal's effort in Delhi to putting this CCTV camera, and that reduces crime against women and other crime. So because we are getting washed, but the actual problem was behavior. Technology actually tried to address that. So if blockchain is there and we are getting noticed that if I do some manipulation, it will come into picture and people will know that, then we'll not do that. So it's kind of that. So behavior will be there, and even people will find a way to cheat blockchain also. So how to address the root cause? Behavioral risk to health data. So phishing is one thing. Social engineering, attacking many use tactics such as pretexting or betting to trick employee. And see, social engineering. Suppose some country want to malign reputation of India, they will start training Chat GPT data with some academic data. Then we as a country need people who can provide the same type of information that is crusade against some country. So data plays a very important. So the right kind of perspective you are not providing in database and academic literature. So our country's perspective will be not taken into account. So who will do that? If the person who understand the basic behind the large language modelers. So not only limited to healthcare, also geopolitics and everything is now the every war will be cyber war. War will be taken by drone. Computers engineers will play a big role. That is endless. So insider employee may intentionally or unintentionally compromise data. So these things happen. Social engineering, phishing, insider. So data can be compromised. Lack of security awareness. Sometimes employee don't know the right password. They give password very easy. Like suppose I am a person and I make my password as Vinetos123. Anyone can guess that. The first thing they will put that as Vinetos123. Weak password, that is the unsecured mobile devices. Now that is now we are saying that 2-level protection, 3-level protection. I was consulted for a company long back in 2015 that was smart sign-in. So how you can put all your logins, because we forget, in a single sign in, and which is 3-level protected. So that technology was developed by one professor from Toronto, computer scientist only. So why not we think about doing something in that direction? Okay, we have limitation, infrastructure limitation that can be addressed only if you think in that direction. Otherwise, never possible. And so unsecured mobile devices. Now that we to reduce our cost in healthcare or everywhere, we told BOYD concept, bring your own devices. So now people are bringing their own devices, so data can be manipulated and like that. So these are behavioral issues. Uh, to mitigate this is organization need to implement security measures such as employee training, security awareness. This you all know. Multi-factor authentication, as I discussed just now. Encryption, I gave example of my smart sign and intrusion detection. Additionally, organizers should have incident response plan in place to quickly detect, respond, and recover. Before integration, new product about application programming interface should be sandbox. Means don't provide API to everyone. It's first sandbox. You observe them, give them text access, then give full access. Sandbox, you know that. So sandboxing approach, I will skip. Actually, sandboxing is, you know now, will we skip that. There is development sandbox, testing sandbox, staging sandbox can be used to address security concern of new devices and which are in development phase. Later, you can graduate them into main system. So that is possible. So don't share your data with any through API to any means product and all. If you are in a product development team, you think about doing sandboxing them, observing them, and Google do that. Actually, when you list a company into their search engine, they don't give them search engine rank. They set it for some time and then you promote that. So for that, they use how a company will come out of a website, will come off sandbox on the basis of the backlink they are getting and from reputed site and everything. Many things are there. Criteria, Google algorithm is there for that. So think about sandboxing. So if you develop approach for sandboxing, that is another research idea. And now why people are reluctant to share health data. Biggest from my anecdotal evidence, my research, whatever I'm doing, privacy concern is the biggest issue. The people don't want to share data. Fear of discrimination. Suppose I say that I'm diabetes and my employer will think that hey, he's diabetic, he will always be feeling sleepy and all. His energy level will be, and suppose he is renal problem, he will be get hospitalized for dialysis or insulin adjustment if he is having something. So this me person will not be productive. So I will get discriminated. The fear of discrimination is there. Lack of trust is there. Suppose that data is related to impotency or something like that. If that data is there, our society is not ready with that kind of mentality and or technical issues. People may not understand how to share their health data or may be concerned about the technical aspect of doing so, such as security risk of compatibility and different systems, lack of incentive. Why I should share data? If I share data and my treatment cost is reducing by 20%, I will do that in India because cost is major concern. So people may not see any personal benefit of sharing their health data and may not be motivated to do so. So this should be linked with that. Incentives should be linked with that. Ayushman, either you use carrot or stick. If you want to utilize Ayushman Bharat, linking is required. So that is carrot method. Incentive, if you are using giving your health information, then you get some incentive in terms of reduction 10% discount or something on pharmacy and something. That is other discount. So lack of incentive. My take home message now is health system are complex adaptive system. We cannot avoid complexity in healthcare, but mental models have limitation and there actually IT comes into picture. IT is not the healthcare, but it is enabler of healthcare. You need to convince doctor that okay, your job is shifting. You are not going to do mundane things like small things and like a simple example, if some person is having hypoglycemia, the procedure is you'll give them 2 spoon sugar and then after some duration you'll give again something to eat. This no, everyone knows this will be taken care by IT recommendation system and everything. You think about some other thing. You think about how to do remission in diabetes so that the people who are suffering from diabetes, at least their diabetes is halted, not progressing to advanced stage if it's not getting revert back. You go in that direction, you solve the problem. Other thing we will be doing using machines. So that is my take. And always start with solving the real problem. So that again, healthcare information system can help in dealing with inherent complexity in the system. Already I told you data is backbone of HIS, but you need to maintain veracity, interoperability, privacy, and security concerns. Uh, there are behavioral and technological risk. I told 80% behavioral, 20% technical. And government regulation policies such as HIPAA and DISA are important, and we will see that in India and happening very soon. And I am not aware about the development, recent development about DISA. I need to revisit it. But if you people revisit it, write a paper with me, and I will be more than happy. Blockchain and sandboxing are two approach to minimize the misuse of healthcare data. And in blockchain, we actually discuss about data lake and everything. We also discuss about how large language models are changing the landscape in healthcare and how we can utilize it responsibly. So these are the things which I wanted to share, and thank you. Only one thing we stressed in this world: the God we trust. All other must bring data, and my another addition is all other must bring data, and the data also we don't test. Need to be ensured that that is accurate. Otherwise, of no use. So that is the input from my side. So veracity and interoperability, forget about velocity and volume and everything. Veracity and interoperability, privacy, security concern need to be addressed in healthcare data to realize it food essential. Precision medicine will come again. AI healthcare will can wait. First, proper storage of data, availability of data, then other application will be built upon that. That's why healthcare data is very, very important. Thank you very much for your patient listening. And now I'm open for questions, and we still have 19 minutes. Yeah.
Thank you so much, sir, for this wonderful and interesting session. It's really very knowledgeable for us, and we relate us in different way with this topic. It's very interesting to know healthcare data analytics, data management techniques, data challenges, interoperability challenges like financial challenge, cultural challenge, and cyber challenge, large language model in healthcare, and many more. Now the session is open for question and answer. If anybody have question, then please ask the question. Anyone? Anyone want to ask any question? Then please.
Anything related to research, anything related to how to
Yes.
venture into healthcare technology using computer science, data science, anything you can ask, not related to this only. Either I was very good or I was not able to convey anything.
No, sir. Really, it's very interesting session because healthcare is very interesting and important session for us and topic also.
We are making a company also in this augmented health, and we'll share more information in future. So anything related to, not limited to today only. If anyone want to do anything in healthcare, any area related to data science, you can approach me and I will be more than happy to do that. Not only Ashoka, anyone from any, and that's possible. Okay.
Okay, Arjun sir, you want to ask any question? Okay.
Hello, hello, sir.
Hello. Yeah.
Yes, good evening, sir. I want to ask one question.
Yes, yes, sure.
Sir, in how many, in other ways, how can we use ChatGPT for research purpose of medical care systems? Or,
Very good. Very good. Let me ask you a question. Whether you were using Google search in your research or not?
Yes, absolutely.
Absolutely.
Always.
So where you were using this for gathering initial information, right?
Yes, yes, sir.
Whether you relied on that to set hypothesis or literature review or making any evidence synthesis?
Sir, first of all, I collect 30, 40 papers, then I compared those.
Yeah. So your answer is no. Google search, you
Yes.
got first information. Maybe you visited Wikipedia, you searched their information that gave you some idea about
Yes,
your
sir.
hypothesis and your plan of research. Okay,
Yes,
that is
yes.
fine.
Yes, sir. Yes, sir.
So this took lot of effort.
Yes,
Okay,
sir. Yes,
that
sir.
effort will be minimized by long language modelers, and ChatGPT is one of that. Many are there in healthcare. Okay, many are there in education. If you want a list, I can
Okay,
give that. Use that,
okay, sir.
but that
Sure.
information always keep in mind that that can be polluted, that can be manipulated. That's why we are discussing about veracity of data. So start with that and now cross verify with actual literature published on that. No. So,
Yes, sir.
and then, and now this, the process of setting a hypothesis or idea and writing a white paper can be minimized using chat GPT and other language modeler. Now your actual work is to do actual research. You find out those articles and read that. No, so you are not wasting your time. Okay.
Okay, sir.
So my
Okay, sir.
concept is, when I told in classroom, I told the student you can use chat GPT. No, but
Yes, sir.
we will discuss in class and we'll check that the information given there is right or wrong. So use that and see is chat GPT is like that we were using Turnitin to find out plagiarism. That's fine. You know that there is another
Hmm.
project and that is called GPT-0.
Yes, sir.
GPT-0 is yeah, GPT-0 to detect whether LLM is used for writing manuscript or not. So utilize that inform. If it is making your work really, see, think about that. When I was child, my mother used to beat me if spelling of something was wrong, and I used to always write spelling of elephant wrong. And when I was in engineering, I used to write phenolphthalein spelling wrong. Do you bother these days whether you are writing the spelling of elephant is right or wrong? MS Word is there to correct you. No. Now,
Yes,
the
sir.
other thing, my teacher taught me how to write grammar. No. Now you have
Yes, sir.
Grammarly. This
Hmm,
thing
hmm, hmm,
embedded.
hmm.
Now no
Yes,
one
sir.
is care about. Your addition will be more than that. Same chat GPT will be there. And that's why I say that not only chat GPT, this type of domain based large language modelers will replace Google type of search engine in future. So that is
Okay,
not
sir.
very ambitious statement. That's going to happen. Now, either you use that in your class and research, you use that. So
Okay, okay, sir.
you use
Absolutely.
it. Okay. Yeah.
Okay, thank you, sir. Thank you very much
Okay.
for.
Welcome. Anyone else?
Sir, anyone else?
Yes.
Okay, sir, I think no question. Sir, thank you so much for this wonderful session. It's our honor to present the certificate to sir for such a great session. Gaurav, sir.
Okay, thank you. Thank you, sir.
Thank you. Oh, thank you. Thank you very much.
Thank you so much, sir. It's our honor.
You can send this soft copy also to me if possible, and that's all.
Okay, sir. Sure. I
Have
would
a great
like to
day.
say, okay, sir.
Yes.
Thank you.
Yeah, you tell me what you are saying.
I would like to say thanks to everyone present over here. Thank you so much, sir.
Thank you. Thank you very much. Bye.
Bye, sir. Dear participants, the attendance form is already shared in chat, WhatsApp group, as well as mail. So please submit the form. With this, I conclude this second day FDP program. Thank you so much.